So I didn't expect this coming in, but our ICU month is fantastic. I knew nothing about the ICU, but the attendings, the upper level residents are so hands-on, teaching you everything you need to know, and we get a ton of procedural experience, which is awesome.
The vast majority of the attendings and the consultants and the nurses, really everyone there was kind and enjoyable almost all the time. And I've heard stories from some of my co-residents and colleagues about their intern years where that wasn't necessarily the case. So in hindsight, I'm very grateful to have spent my year in Des Moines where the people really are friendly.
I would say being radiology bound and now being in radiology residency, we have what's called these kind of radiology clinic days where once a week the radiology bound residents would sit with either a diagnostic radiologist or work with an interventional radiologist for a half day, starting about 12:30 or after kind of the noon conference time. And go all the way until 4 or 5, however long that they would keep you. And that was an invaluable experience for me.
A few months into my radiology residency, I found myself in a position that I didn't expect in radiology. I was in charge of running a code on a patient who had coded while being scanned, and the hands-on training that I received at Iowa Methodist and the experience I had from being put in those situations before allowed me to do what was needed then and anticipate the next steps in that patient's care.
In terms of the people in the program, I really enjoyed all my time with the attendings and staff, as well as the other residents, whether they were TYs or other prelims or even categoricals. We spent a lot of evenings playing board games together or going to new restaurants together. And the attendings and the staff all really enjoy teaching. There's not a whole lot of research or fellows, which means there's a lot more focus on teaching the residents.
I got to do electives in dermatology and dermatopathology. There's so many different options to kind of help tailor your education to your specific specialty. And if there's not an elective you want to do, then the program is very flexible in creating that experience for you.
I think my favorite experience was probably the monthly meetings we have. So every month we get together and have a lunch meeting where we get food catered in from whatever restaurant we choose, and we talk about the service we're on and give each other advice, and kind of a just good time to get to know your residents better and hang out.